Well, good morning. My name is Chris Florina, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Primary Care or Residency or PCR informational webinar. Before we begin, we want to make sure that everyone knows who this webinar is for. Today's webinar is for new and continuing applicants to the Song Brown Primary Care Residency Program. The PCR program provides grant opportunities that will result in funding for organizations to educate and train primary care providers to work in underserved communities, and it is administered at the state level by HCAI. Here's the agenda for today's webinar. As I said, I'm Chris Rowena, and I will be doing the housekeeping and the introduction. After that, Jonathan Nazario will be doing the program updates, application processing requirements, and at the end, we will have time for a question and answer session. And lastly, before we begin, I'd like to discuss a few housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Number two, today the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. Number three, the webinar will be recorded and posted to our website in approximately 7 to 10 business days. The slide deck and the resources links are posted in the chat, and you can access those. And with that, it is my pleasure to introduce Jonathan Nazario, the Song Brown PCR Program Officer.
Hey, everybody. Again, my name is Jonathan. I am one of the program officers for Song Brown. A little bit about Song Brown. We provide funding to education programs, including primary care, family nurse practitioners, registered nurses, and midwifery programs. Song Brown provides financial incentives to programs to graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to the program, locate the program's main training site in a medically underserved area, operate a main training site at which the majority of the patients are Medi-Cal recipients. Next slide, please. Here are some important application dates. As you all know, the application is currently open. The early submission date is August 27th. The deadline is September 10th. Please remember these dates as they are important to you. Next slide, please. Before you apply, keep these important information in mind. If your program requires approval to contract from a coordinating authority, inform that authority of terms and conditions contained in the grant agreement. Applicants must agree to the terms and conditions before receiving funds. HCAI will not make changes to the terms and conditions specified in the grant agreement. Funding shall be used to expand primary care services. Funds should not supplant existing federal, state, or local funds to provide primary care services. Next slide, please. The new changes for this year are for new program strategy questions. They have changed. The program data page has changed. The resident data page has changed to collect aggregate data. Next slide. Here's some information you might want to gather before starting the application or during the application process. You're going to need the correct organization name and address. The legal name for your organization must match what is reported to IRS. Also, you're going to want to collect your signatories for the grant agreement and payee data record information. Please keep these in mind because previously, we have had a lot of issues with these where people have been providing the incorrect names or signatories. And when we get to the agreement process, if rewarded, people have been causing delays with the agreement process because they haven't been providing the correct information. So please, if you can give us the correct information during the application process, this will help everybody during the process. Also, please collect the facility type for each primary care continuity clinic training site, your payer mix information, and your race and ethnicity for all data for current residents. Next slide, please. Other information to gather, your current practice site information, your national provider identification number or NPI number, any required documents such as your ACGME accreditation letter or expansion letter, and permission from your organization to apply for this grant agreement. Next slide, please. For new programs, information you want to gather. Same thing, your organization name and address, and then your signatory information. Again, to recap, please make sure that they are the correct information and correct signatories, because this will help us with the agreement process if rewarded. Also, you're going to want your facility type for each primary continuity clinic and your payer mix information. Next slide. For new programs, depending on the phases you select, you're going to be required to attach certain documents. If you select phase A, you'll need to provide us a institutional affiliation letter. If you select B, C, or D, you're going to provide us those attachments or those that information. So please try to obtain that information or those documents before you start applying or during the application process. Next slide. Here are some program funding categories for PCR. We're going to have existing primary care programs. We're going to have teaching health center, and you're going to have expansion programs. Next slide, please. We also have funding categories for new programs and new programs that match. Next slide, please. Here's the available funding for existing slots. It's 18.6 million. For teaching health center, it's 5.6 million. For expansion slots, it's going to be 3.3 million, and for new programs, it's going to be 3.3 million, for a total of $31 million available for funding this year. Next slide. Here are some helpful resources you may want to utilize during the application process, including to this TA guide. We have the Song-Brown glossary, and we have the PCR grant guide. Next slide. Here's the EAP registration slides. We're going to skip this slide due to the fact that everybody has already either created an account or set up their profile, but these are the slides to do that. If you want to reference this TA guide, if you haven't done that process yet, you can go to our website and it will be available there. Also, if I'm not too mistaken, they're going to be adding this link into the chat. So you can click on that link to access the TA guide and to reference this TA guide and these slides. Please skip ahead to the next portion, please. Okay, helpful tips. Here's going to be some helpful tips to help you with the application process. First slide is going to be how to navigate the application. You can have a previous and a next button. If you want to save the progress of an application, you're going to click on Save and Next. If you want to go back in the application, click on Previous. Unfortunately, you can't go from one section to the next section during the application. You have to either utilize the previous or the Save and Next button to navigate through the application. And again, if you want to save your progress, please be sure you click Save and Next after you input your information, and that will save the progress in your application. Next slide, please. You're going to see some asterisks and tooltips during the application. Asterisks are items that need to be inputted in there. If you don't input that information in the application, it's going to prevent you from not going to the next page. So you need to input that information into the application that has an asterisk to continue with the application process. Tooltips are useful little question marks you'll see throughout the application. If you click on a tooltip, you're going to see further information regarding that subject. And if you hover over that question mark or the tooltip, you're going to see more information regarding that subject. Next page, please. Starting an application. Next page, please. Here you can see the program information page. Program information page is going to have your program type, and it's going to have the training program information. If you haven't here with Song-Brown already, you would have your training program information in here already. If you do, you're going to need to click on the little magnifying glass to look up your training program name. If you're new to Song-Brown or PCR, you're going to need to click on training program not listed. Again, if you have applied before in the past, your training program name is going to be in our system. So please utilize the search function in the training program search area to try to locate your training program name. If you can't find it, please let us know and we'll help you with that process. Next slide, please. If you're adding a new training program, you need to include your training program name, and you're going to need to locate your address. And you do so here by inputting your address and then searching for your address. Next page. Once you're done with that process, the training program information, you need to select the award category you want. We have new programs, existing, THC, and then expansion slots. Next slide, please. New programs. Next slide, please. For new programs, you're going to have the program data page first. The program data page is going to have questions regarding if you're a GME naive or a non-naive program. It's also going to have your phase selections. Depending on the phase selection you choose will determine your eligibility for the new programs or new programs that match. If you want to be eligible for new programs that match, you're going to have to select phase A. If you don't select phase A, you're not going to qualify for new programs that match and you will not be able to proceed with the application. So phase A is going to be a requirement. And don't forget, when you select phase A, you'll need to provide the affiliation letter along with that at the end of the application. Next slide, please. To be eligible for the new programs, you're going to need to select phases A, B, C, and D. Once you select phase D, you're no longer going to be eligible for new programs that match. You're now eligible just for new programs. Selecting E, F, and G will still qualify you for new programs. It's just letting us know how far along you are with the accreditation process. Next slide, please. If you select phases A through C, again, you're going to be eligible for new programs that match. Just keep in mind, again, once you select any of those phases, you're going to need to provide us additional documentation regarding that. Also keep in mind that when you're if you do qualify for new programs that match, you have to be willing to provide that 25% match on top of whatever you're awarded. Next slide. So for example, if you're awarded $2 million, the grantee needs to provide 25% match. That'll be a total budget of $2.5 million for new programs and match. So, next slide, please. Okay, now new programs application. Next slide. First, you're going to start off by selecting your award category for new programs. You check the box and click Save and Next. Next page. Next page, you're going to get to the contract administration page. Contract administration page is where you put your contractor, organization name, and information, in addition to your signatory information. Again, we want to make sure that everybody says that we want to make sure we get all the correct information on this page during the application process, because this is information that is going to be carried over to the agreement process. So if this information in here is correct at the moment of the application process, this is going to help everybody out later during the agreement process. So your contracted organization name needs to match what is reported to the IRS, and your signatory information needs to be the individuals that are authorized to sign your grant agreement and your 204, or your payee data record. Next slide. Here is going to be your program data page. As previously mentioned, you're going to choose about your selections regarding your GME and naive or versus non-naive questions. You're also going to choose your phase selections. Depending on your phase selection will determine your eligibility for new programs and new programs to match. A through C means you qualify for new programs that match. Anything past C, so you select D and below, you're going to be qualified for just new programs. New programs that match, you're going to need to also provide that match funding. So keep that in mind too. Again, next slide. So after you select phase D, you no longer qualify for new programs with match. You just qualify for the new programs. Selecting yes to phase D means you qualify for new programs. E, F, and G is the same thing. You qualify just for new programs. Next page, please. If you do select D for training sites, that you have training sites, the next page is going to give you the option to adding your training site information. If you don't select phase D, you're not going to see this page. So this is just for people that have selected phase D, and you'll be seeing this page for training sites. You're going to click here to add a training site. So if you have training site information, you're going to click on add a site. Next page, please. Once you click on add a site, you'll see this screen here. This screen is going to give you the option to input your training site information, also to search for your address, and also you need to provide your facility type information. Your facility type information, if you don't know what your facility type information is or facility type is, we provided links into the application. You can utilize those links to help you with the process on finding a facility type. If you have any questions that you can't find on those links, or you have any questions regarding in this process, please let us know. Next slide, please. On this, you also gonna need to provide your payer mix information if you do have that at that moment in time. We understand if you're a new program, you may not have this information, but if you do, please provide us that information. Next page. Once you added a site, you can add another site. Again, simply by clicking Add a Site. If you want to edit or delete the site you previously entered, you can do that by clicking the little button on the bottom, the drop-down button, and you can edit the site or delete the site that you just inputted. If you want to continue on with with the application process, just click on Save and Next to continue to the next page. Next page, please. Next slide. Here's going to be your executive summary and program strategies pages. For executive summary, we just want to recap of your training program, basically what you guys are about. Character limit, the max is 2,500 characters. So keep that in mind. So if you copy and paste from a document somewhere, all of it may not be included because you have a maximum character limit of 2,500. Next slide, please. For new programs, we changed the strategy questions. Now we have up to 5 strategy questions. Each page has its own strategies. There's multiple strategies per page. Select a strategy that pertains to your program or strategies that pertain to your program. You can select as many that pertains to your program. Keep in mind, after you select a certain strategy or select a certain item in the strategy, it's going to prompt a box that you're going to need to provide further information regarding that strategy. So we just want to know more about that strategy and want further information regarding the strategies you're selecting. Next page, please. Next, we're going to want to know your residency training information. We want to know how many residents, first-year residents, you're going to be accredited for, and that they will be working side by side with FNP or PAs. Next slide, please. Here's going to be where you input your expected expenditures. For $1 million, please put that here. $2 million, put that here. If it's a different amounts, please, if it's under $1 million, you can also put that here. If it's under $2 million, put that here. So all the funding requested amounts, you're going to put that here. Then click Save and Next to proceed with the application. Next page, please. If you select phases A through C, you're also going to need to provide a budget table. Actually, for all phases, you're going to provide a budget table. Here for phases A, B through D, and E through G. And then we have different categories, one for personnel, one for consultants, one for faculty salary and benefits, or other. Please input all your budget information here, and then click Save and Next to proceed with the application. And next page, please. Once you get to nearer to the end of the application, depending on the phase selections you selected, you need to provide additional documents. If you selected anything past phase D and below, so D, E, F, and G, you need to provide a letter of sustainability. If you selected the phases A through C, you need to provide additional documentation regarding that, regarding those phases. If you have any questions during this process, please let us know. Again, depending on the phase you select, will determine the documents you need to upload and attach. Next page, please. Once you upload your document, you're going to see that a little link on that page. The little blue link is going to indicate that the document has been attached. If you want to edit your document or delete it, you can click on the little drop-down button there on the left, and then you'll be able to delete it or edit it and proceed with the application for that. Next page, please. After you're done with that page, it's going to take you to this page here. It's the assurances page. Please click the little button to certify that all the information you provided is accurate to the best of your ability. Then click Save and Next to proceed to submit your application. Next page, please. Once you submit your application, it's going to look like this. Next page. Once you submit your application, you can view and print your application. You do that by going to under Applications in Progress, clicking the little drop down, click on View and Print, and you should be able to print your application. Next page. Now I'm going to start the application process for THC, existing, and expansion. Next page, please. A lot of this information is going to be similar to what we mentioned in new programs. So we're not going to go over it in depth, but we will do quick recaps on these. Here's going to be your program information page again. If you're existing expansion in GC, most likely you're going to be in the system already, so you're not going to need to click the training program not listed. If you can't find your training program name, please let us know. But you should be able to search for your training program name under the little magnifying glass and try to locate your training program. Your award categories is going to be at the bottom. Please select existing THC or expansion to continue with the application process for any of those award types. Next page, please. Here's going to be your contract administration page. Please provide your contract organization name here and your signatory information. Please provide us the correct information during this process, during the application process, because again, it will help us with the agreement process, and providing incorrect information here could delay the agreement process if awarded. The contractor administration information needs to match what is reported to the IRS, and your signatory information needs to be the signatory authorities that is authorized to sign your agreements and your to enforce all your pay data requirements. Next page, please. Here's going to be your program data page. Here you're going to choose information regarding if you have residents or graduates, resident data, or if you're in a new program and you don't have any of that information. You can also have the ability to import your information. Please keep in mind, though, that you can only import your graduate and training site data. We no longer can import the resident data due to the updates to the resident page. We are now just collecting the aggregate information with residents, so then that's not going to be imported over anymore. But that information is no longer going to be on an individual basis, it's going to be on an aggregate basis, so it's easier for everybody. Next page, please. Here you're going to add your training sites. If you want to add a new training site, please click on the Add a Site button here. Next page, please. Here you're going to add your training site information. You can also find your facility type information. If you want to see what facility type your training program is, please click on the links here, and that will help you with the process. Next page, please. Here you're going to provide us your payer mix information. If you have that, please. It doesn't need a total 100%, so keep that in mind. But please input your training site payer mix information here, and then click training sites reviewed for accuracy, and then click Save and Next. Next page, please. So from here, once you added your site, you can add more sites, or you can edit and delete your sites. Keep in mind that if you use the import feature, your training sites may be importing over. If it does, you're going to need to still review it, update any information if it's applicable, and then click training sites reviewed and save and next to continue with the training site page. So keep that in mind if you're importing your training sites over. Next page. Here's going to be your executive summary information. Here you're going to want to know your more information about your training program and everything that pertains to your training program. So basically give us a brief recap of what your training program is all about. Again, there's a maximum character limit at 2,500. Next page, please. Here's going to be the funding and expenditures page. Please provide all your funding and expenditures relating to your program. And this is also going to be the requested amounts you're going to want to request from Song Brown regarding your PCR program. Next page, please. If you select for a teaching health center award type, you're going to need to provide you a budget information regarding your teaching health center budget summary. Left side is going to be your annual budget. Right side is going to be the requested Song Brown funding for the THC program. Next page, please. Here's this is the new resident data page. We're now going to be collecting aggregate data rather than individual resident information. So you need to put all that information here. We're also going to want to know their race and ethnicity and all other enrolled residents. So this is the new aggregate resident data page. Once you're done, click Save and Next to proceed with the application. Next page, please. The graduate page is also looks new, but is still the same concept. We basically combined the graduate program data page and the graduate page into one, where all the graduate data is on one page. Here we're going to input all the graduates you have for the years that we're requesting. Also, if you want to add any graduate, you'll be adding any graduate on that exact same page. Next slide, please. To add a graduate, please click on the Add a Graduate button. Next page, please. Once you click on that button, you're going to have the ability to also select your facility types for that graduate. Again, if you don't know that facility type, please utilize the links that we provide you. Next page. If you want to edit or add any more graduates, you do that here. Again, if you're going to be importing over information from the last application, you're going to need to review that graduate, make any edits. You probably want to make some edits due to the new year, or delete a graduate if it's old data. Again, we only want to collect data that pertains to the years that we are requesting. Once you're done with all that, click the check here box to make sure everything is okay. Then click Save and Next. Next page, please. During the applications process during the years, we've identified some common application errors and mistakes. For example, applicant did not enter any data for residential graduates, even though they did have that data. Please make sure you're providing all the data that pertains to your program. We want to know all about your residents and your graduates pertaining to the information that we're requesting. Applicants entered practice sites that are out of state. We just want to know about your graduates and practice sites that are within California, not the ones outside the state. Applicant did not provide the correct contractor organization name. Again, we want to make sure that you're providing us the correct contractor organization name. This helps during the agreement process. It needs to match what is reported to the IRS, and it also will show up on your W-9. Applicants don't provide us the correct signatory information. Please ensure that the signatories provided during the application is just the correct signatories. They need to be the authorized individuals that can sign your agreement and your pay debit record information. Also, applicant added a training program, did not search for previously used training programs. Some applicants, they just select a new training program or try to create a new training program. They don't look for the previous training programs if they already applied for Song Brown. So again, if you've been with Song Brown before, utilize the search function to find your training program. Most likely it's in there if you've been here with Song Brown already. If you need any help with that, please let us know. We'll help you with that process. Next page, please. Okay, depending on the award types you selected, if you selected existing expansion or THC, you need to provide us your ACGME accreditation approval letter. If you selected expansion, you need to provide us your expansion approval letter from ACGME. Once you've done that, just click Save and Next. Next page, please. Yep. Once you do upload your documents, you're going to see that blue little link. Again, if you want to delete it, because you might have made a mistake or something happened, please click the little drop down to delete the document. You can also re-add the document by clicking the same button to add that document pertaining to your application. Next page, please. Next, you're going to go to the insurances page. Here, you're going to, again, certify that all information is correct and accurate to the best of your ability. Once you're done with that, click Save and Next to submit your application. Next page, please. Once you submit your application, you're going to see this screen here that says submission has been completed. Next page, please. Once you submit your application, you can always go in Applications in Progress to view and print your application. You can see all the information that you inputted under this page, and you can also print the application after you submitted it. Please keep in mind, once you submit your application, you cannot make any more edits to it. So once you submit it, you submit your application. If you have any questions during this process, please let us know. Next page. I'm going to hand this over back to Chris, if I'm not mistaken, but if you have any questions, please let us know.
All right, thank you so much, Jonathan. As you can see, our team has put a lot of work into this program, and we're excited that you've joined us today to learn more. We are going to transition into our question and answer session. The chat option is now open and available in the menu bar at the top of your screen. We do understand that some of you may not be able to access the chat feature in the browser version of Teams due to your organization's restrictions. Some find that the mobile version does provide chat access. If you are still unable to access the chat feature, please email your questions to songbrown@hci.ca.gov, and we will answer your questions there. Thank you for your understanding in this. We will answer all of the questions in the order that they're received, and we'll do our best to answer all of the questions that you have today. So let's go ahead and go to the chat, and let's see what kind of questions you guys have going on today. All right, first question. David asks, are there any significant changes from prior years to the application in this year's?
The most significant changes, if you're existing Spanish or TAC, is going to probably be that resident data page. Again, we'll be collecting the aggregate data. I know in previous years, we've always asked you to keep all the data regarding all your residents. So you kept all their names and all the information that we asked for, but now we just want to collect the aggregate data regarding how many residents you have and the race and ethnicity of your residents. So it makes the process a lot easier, and it helps us with data collecting the data that we need. The graduate data page has changed, but it's still going to be the same concept again, which is making the application pages or application process a lot easier for everybody, and collecting the data that we need. But those are probably the most significant changes, but it shouldn't be a big impact. Thank you for your question.
Perfect. Thank you, Jonathan. Next question. We often have residents that are multiracial or more than one race ethnicity. Are there plans to update this section to allow us to account for multiple ethnic residents or multi-ethnic residents?
Thank you again for your question. At this time, we haven't taken that into consideration, but we can keep that in mind for later developments in our application. We are always trying to do our best to update our application to fit everybody's needs, but we would definitely keep that in mind for future updates in the application. Thank you for your question.
All right, thank you. Next question, Brandy asks, we have a new PD and he is not familiar with the application process. How can I be included to view work on the application?
Hello, thank you again for your question. So if your program director wants you to view the application, even make updates to the application, you can do so by creating an account and then updating your profile, then having your program director assign you to his account. They do that under their profile, clicking add an assigned user, then they can add a grant preparer. If you reference this TA guide under the registration information, I think it's going to be page 14. It's going to show you that process. So, and if you have any questions, just let us know. But once he adds you, you should be able to edit and make changes to the application or even view it. Just keep in mind that you won't be able to submit the application or start an application. Only a program director can do that. If you have any questions, please let us know. We'll be happy to help with that process. Thank you.
All right. Angelica asks, when submitting applications for early submission, will we receive feedback if we are not meeting minimum scoring requirements?
During early submission, we do our best to provide feedback to applicants, especially when it comes to things that are kind of odd or strange. So we do our best to try to provide feedback to applicants regarding things like that. If it's data that we feel that is accurate and it's to the best of the applicant's ability, we may not reach out. But most of the time, we try to reach out to an applicant when we see something that looks off or strange or they don't meet requirements, like you said.
All right. And you can see in the chat, we have reposted the resource links in the email. So if you have not yet, you can go ahead and check out those resources for you. Samuel asks, for the new program applications, is it recommended to create strategies for all possible strategy options to create a stronger application?
We recommend, hi, thank you again for your question. we recommend that you provide us the strategies that pertains to your program. We don't want anybody to include anything that doesn't pertain to your program. So the strategies are there for you to select that does pertain to your program. If you have any questions still after this, please let us know. But hopefully that answers your questions. Thank you.
All right. And then Jennifer asks, when submitting for early submission, will we have the opportunity to speak with staff about feedback provided? Also, is it possible to get details on your score for the prior year?
So for application feedback, there will be opportunities for you to talk to us. We normally send out emails to everybody when they submit the application early review. Normally we do notify people that their application has been reviewed. If there's anything that we found, we do provide information in an email regarding that. If we didn't find anything, we'll let you know. But that will still be opportunity to provide feedback, asking questions. Regarding seeing your previous scores for last year, you can request that. We'll do our best to provide that information to you. Just please send us an email on that, and we'll do our best to try to provide you that information. Just please give us time when you ask that, because it takes a process for us to look at your previous scores and to give you information regarding that. Thank you.
And Kelly asks, will you confirm that only $31 million is available for this year and that this has not increased in recent weeks?
So, yes, so we have $31 million available, and this is the current funding that we have for PCR. Yes. Thank you for your question.
All right. And we'll give some time if you guys have any other questions. Let's get those into the chat. As a reminder, if you still have questions or you're unable to access the chat feature, email your questions to songbrown@hci.ca.gov. I want to remind everyone that we are recording this webinar and it will be posted on our website within 7 to 10 business days. And we will also be posting the slide deck as well to the website. Again, you can find the resources. We've got the link to the primary care residency page, the grant guide, the technical assistance guide, Song Brown glossary, and as well as the application link posted there. We'll give about another 30 seconds for people to get their questions in. Jonathan, it's looking like you did a pretty good job on this. There aren't too many questions today, so we had a very thorough webinar. As a reminder, the application deadline is September 10th at 3 p.m. And it looks like we may be done with questions today. So thank you all for your participation in the Q&A session. We value your questions, and we do these webinars to make sure that we get all of your questions answered. If you do have more questions, as I said, email the team at songbrown@hci.ca.gov. As a reminder, we will be posting the webinar and the slide deck to our website in approximately 7 to 10 business days, and we'll go from there. I do see one more question. Let's go ahead and get that answered here. Let's see. LB asks, in the past, we used to be able to apply as an existing program for all of our residents and then also apply for THC funding. As of last year, we can only apply for one or the other for each applicant. Is that because of funding cuts, or was there another reason for the change last year?
Okay, good question. So, if you review our grant guide, we get more specific regarding the existing and THC funding and what you can qualify for. So we saw that people were applying for existing and THC slots for the exact same resident. So if they were only accredited for 5 residents, they were applying for 5 resident slots for existing and 5 for THC. So they're kind of like doubling the funding. So we wanted to make sure that people were applying for those accreditation slots that were unique to the program. So basically, if you had 10 residents, you can apply for 5 for existing and 5 for THC. But if you just have 5 residents, we don't want to apply for 5 existing and 5 THC. However, if you want to apply for existing and THC and you have 5 residents, you can apply 3 for existing and 2 for THC. You can do that too. It just all depends on your funding needs and when you need the funding. But that's why we did that, and that's the current system we have. Again, if you want to dive more into it, we do have it in our grant guide. It provides further information and breakdown regarding THC and how that funding works. You can also always email us and ask us more questions if you have more questions, and we'll do our best to help you with that process. Thank you.
All right. Thank you so much, Jonathan, and thank you for that question. All right. Well, we appreciate everybody joining us today to learn more about the Song Brown Primary Care Residency Program. We are excited to be able to offer it as a part of our health workforce development efforts at HCAI, and I'm grateful for your participation with us today. We do have some resource slides that we would like you to look at. One of the ways that you can stay up to date with all of the HCAI happenings is to sign up for our monthly newsletter. You can go to that link right there and subscribe to the workforce newsletter through that, and also select some other options that you may be interested in receiving updates on. Let's see, you can contact us through phone at the phone number 916-326-3700, and you can email songbrown@hci.ca.gov to contact us. Also, we have our social media handles, and you can follow us at Facebook, LinkedIn, Twitter, and YouTube. And we encourage you to check out all of the great resources that HCAI offers. As a reminder, the application cycle does close September 10th at 3 p.m. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.